Hi, this is Edusam. Welcome to my lecture on the gross anatomy of lower limb. So I'll be introducing you to gross anatomy generally. I want to talk about gross anatomy. I want to talk about anatomy. The word anatomy. What does it mean? So anatomy itself is simply the science that deals with the study of internal and external body structure. So you need to know that the word anatomy is divided into two main branches, which is the gross and what the microscopic anatomy, otherwise called the histology. So get the fact that gross anatomy is a branch or a subdivision of what anatomy. So when we talk about gross anatomy, what do we mean by gross anatomy? Because you can't find some of the things I will say on this slide, so please follow me carefully. So the gross anatomy is just the part of anatomy that deals with the aspect that deals with the structure that can be seen with your naked eye without any aid, no other special aid, high aid. So that is the gross anatomy. But when we talk about microscopic anatomy, it is that aspect that deals with the use of what of microscope to visualize um some aspect of the tissue or cells that cannot be seen naturally. Alright, so that is the simple introduction for to this broad word called anatomy. Alright, so and you can know some historical background. You need to know general knowledge that um Euophilos is regarded as the father of what of anatomy. So as simple as that. So now let's talk about the main business. I can't go by teaching you some complex topics without introducing you to some terminologies. In the study of gross anatomy, you need to get yourself familiar with some terms. Although some of these terms we know them before, and there are some that you might not have heard before. Alright, so let's start with the basic ones. So the first one I have on the slide here is what anterior. So and this is quite explicit. When you say something is anterior, talking about the front. So if an human is standing in such a way that you can see the chest, what you are seeing is the anterior view. So it's a term that can be used to describe a structure in anatomy. So similarly, you can call this anterior view, you can refer to it as ventral. So it's still similar. So the next is what posterior. When say posterior, talking about dorsal, back. So when someone is standing in front of you in such a way that you can see the person buttocks. So what you are seeing is what is the posterior view. Such a way you can see the person's back. That is the posterior view. Alright, so the next term is what superior. Say superior is a common English word. So superior is like something moving upward, something above. Inferior is what is below. So the similar word to superior in anatomy is what is cranial, while inferior is what caudal. Alright, so the next one I'll talk about is medial and lateral. Medial and lateral. So I will explain that with an image to make it more explicit. Talk about medial and lateral to make it more explicit. So you can see the image here. So if this is the midline, so talking about medial and lateral is in reference to the body's midline. It is in reference to the body's midline. Alright, so this is the midline. This line you can see here, that is the midline, this line. So and anything towards this midline is referred to as medial. So anything that is far away from the midline is what is lateral. For instance, let me explain with this with some structures of the body. So over here we have at this side we have, let's say we have the nose at that region, this line. Over here we have the eye. So you can say that the eye is lateral to the what? To the nose, because it is like moving like this. It is away from the nose. And while the nose is what? It is medial. It is medial to the what? To the eye. So it is a term that is commonly used to describe the other structures in anatomy, that is medial and lateral. Alright, so next thing I'll talk about now is abduction and adduction. they at times they are always mistaken for each other. So talk about abduction. Abduction. Abduction is the movement of any part of the body away from the midline. So if you move in such a way that if you move your hand, or let's say, let me take an instance, your hip joint is one of the joints that can carry out abduction and adduction. Your shoulder joint can also do the same thing. So for your hip joint, for an instance now, let's assume you are standing in such a way that you have just one of your leg on the floor, and the second one you try to swing it sideways, not forward, sideways. What you just did is what? You just abduct the leg. You are taking it away from the midline. So if you swing the leg in such a way that you have just one leg on the floor, the other one is going sideways, that is what? Abduction. Now, while returning that same leg towards the normal position, that is what we call adduction. So let me quickly explain that. Let me show you a GIF so that you can have better understanding of that. So this is abduction and adduction being demonstrated by the shoulder, for the shoulder here. So you can see this is adduction. Going up is what? Is abduction. Adduction, abduction. So simple as that. Alright, so another thing I will talk about is flexion and extension. So you can see that in this diagram here. So you can see the leg being flexed, and you can see extension being carried out here. So what is the difference between flexion and extension? It's very simple. Flexion is a kind of movement in which the angle at that joint is being decreased. So let me give an instance. You are trying to lift a load with your hand. I'm coming. Let me grab the pen. Okay, so let's give an instance of you trying to lift a load with your hand, and your elbow will of course be involved in that kind of movement. So you carrying that load, what you just did is what? You just flexed your elbow. Now by the time you are dropping that same load, you are extending the elbow. So that is extension. You can see that here, extending the elbow. So although this image is focusing more on the shoulder joint here, so you can see flexion of the shoulder, taking the shoulder upwards, with the shoulder joint here, and you can see extension, taking the shoulder backwards. So the shoulder joint can also be flexed or extended. So but what is the keynote there? In such a way that you are decreasing the angle, that is what? That is flexion. In such a way that you are increasing the angle is what? Extension. So you can also flex the knee joint here. You can see this is flexion, then taking it back is what? Is what? Extension. So the basic thing. So lastly, I'll talk about planes. We have some planes that you need to get yourself familiarized with in gross anatomy. So one of these planes is the mid sagittal plane. Let me explain what a sagittal plane is. So sagittal plane is just the line that divides the body into left and right. Divides the body into left and right. So here is the body. This line passing through this side, this red line, is what? Is the sagittal plane or sagittal line, because it is dividing the body into what? Left and right. But then I can have another line dividing the body into left and right without passing through the center. It is also a sagittal line, but the difference is that this one not passing through the center is referred to as parasagittal line, but that one passing through the center is referred to as what? Mid sagittal line. So mid sagittal line is the line that passes through the center in such a way that it divides the body into equal left and right. Don't forget the vertical line. Alright, so next one I'll talk about is what is the frontal plane. So the frontal plane is the plane that's an imaginary line. They are all imaginary line actually. So that divides the body into front and back. So it is called frontal, or otherwise called the coronal plane. Look at this blue here. This is the frontal plane. You can see the frontal plane dividing the body into front and back. So and lastly we have the transverse plane or horizontal plane. So this is the green line here, dividing the body into our superior and inferior aspects. So just like the way you slice your orange. So as simple as that. So so are the basic terms that are needed for you to understand this course as we move on. In the next video I will talk about the lower limb proper.